Thank you for joining today's webinar. My name is Ray Kuhl. I'm CEO of PBSI Technology Solutions. I want to thank our longtime partners at the Academy of Medicine for envisioning the need for this important information with the goal of protecting clients and helping everybody in the healthcare space learn some things that are important to all of us in the current world of security difficulties that we all understand well. So the goal of this series, this is number 3 in an 8-part series. The purpose is in each case to inform and educate, to improve knowledge about electronic security and to provide practical information about what to change if we need to and how to do so. So in the first 2 sessions, which are all recorded, if you haven't attended, you're welcome to request recordings. We covered the basic essentials of security in healthcare. We talked specifically about email security, which is really important. Today, our topic is file encryption, cloud security, and public Wi-Fi. And then you see the list of upcoming topics. Each has important and relevant content. Each, we will cover the topic in 1/2 hour or less. So today's agenda is quite straightforward. We're going to talk about file encryption briefly. What is it? Why is it important? And then how to. The 2 key areas of encryption involve in transit, generally via email or when we're sending files through a different method than email. How do we encrypt and why in transit? And then encrypting information at rest. There's some confusion around this topic. We'll talk about what we need to encrypt, how we find out what we need to encrypt, and how to go about it. Separately, we'll talk about some areas around using the cloud securely, some good concise information that we've learned over a period of time. We continue learning all the time at PBSI. And then finally, we'll talk about public Wi-Fi. This is a simple topic, but it's very important because there's some misunderstanding that goes on. So that's our agenda for today, and we'll dive in. So I want to thank those of you who are longtime PBSI clients and friends. We have so many hundreds of physicians and providers in the greater Cincinnati area who've been long-term clients, including the Academy of Medicine. And then for those of you, and there are many of you where this is your first exposure to PBSI, I want to just say thanks for your attendance. As CEO of PBSI, the most important thing I can say is I'm very blessed as CEO of this organization to know that the very large percentage of our staff have been with us for a long, long time, and I know that knowledge helps clients. So our main focus in the healthcare arena is proactive IT security and security monitoring. Today's topic, the basics of file encryption. So what is file encryption? Why is it important? Encryption is a simple term that describes data that can't be read without a private key, being a password generally. And encrypted data is garbled, so it can't be opened or easily read or interpreted without that key. Encryption security varies based on technology used, and important to understand, I think a lot of people know this, that the strength of encryption is most linked to the length of the key. So using an 8 or more character password is immensely more difficult for a hacker to crack than if you use a shorter password. So long passwords in particular are encouraged when it's important to protect either a login or a document. So file encryption simply means we're garbling the document so it isn't available to be opened without the key. So what information needs to be encrypted in a healthcare environment? We're talking about protected health information, PHI, or electronic PHI, but the same guidelines apply to PII in the rest of the world, personally identifiable information, which generally includes a name associated with a social security number and or a credit card number, a date of birth, an account number, a driver's license, passport, ICD codes, CPT codes, anything that connects a real person to one or more of these things is protected, and we have an obligation, not just because HIPAA says we have a legal obligation, but I think those of us who are involved in healthcare for a long time understand we have a moral obligation to help protect patient information, and we take it seriously. So the goal of today really is to help us learn some details about how we go about doing that. So the 2 kinds of data we're protecting are at rest. So that would mean it's a file that's stored sitting on a hard drive. It might be sitting on your C drive, it might be sitting on a shared network drive, it might be sitting in the cloud, but it's at rest, it's not being used. Why do we need to protect that information? Who are we protecting it from? The basic idea is we're protecting it from future hackers. If my PC or my network were compromised and they were able to scan the hard drive in question, what could they learn, and how valuable would it be to them, and what kind of risks would it present? So the basic idea is we need to understand that encrypting information is a protection against what might happen. So unless it's in transit, it's not really actively interpretable. So for most of us, the most important thing to understand is how to protect information in transit. And in transit has two forms. One is we're emailing, we're sending an email, and hopefully everybody listening knows that the email of PHI is prohibited by HIPAA unless it's encrypted. And email traffic is scannable by anyone on the internet. We'll talk briefly about that. But in transit, the most common form is we're sending information by email. It also is related, though, of files that are being transferred. So we're sending a file to our accountant, or we're sending a file in any form, uploading it to a place on the internet that is in transit. And we need to make sure that the protection's there both at rest and in transit. So how do we protect information in transit? The reason we need to do it is email traffic can easily be interpreted. The stories most of us have heard and understand that NSA can interpret all the traffic that goes on. Well, it's not just NSA, it's Google, it's any hacker with the right free tools can interpret every piece of email traffic looking for things that look like social security numbers or dates of birth, where they then have electronic tools to drill down and try and intercept information that's useful. So whether or not we think that threat is real, the fact is the truth that they can do it is real, and the truth that hence HIPAA requires protecting that information. Basically, it means we need to encrypt email and information that's in transit. 3 ways to encrypt information during sending of an email, and that is to encrypt the email itself or to encrypt the attachment, and then we can send a clear email if the only protected information is included in the attachment that we, and I'll show you how to do that. We'll look at how to encrypt an email, we'll look at how to encrypt an attachment. And then a third method is to use a secure file sharing portal like many banks and CPA firms use, where you can use ShareFile or a similar service. But when it comes to communicating with patients and referring sources, generally the things that we're concerned about are protecting emails. So I'm going to do a short demonstration of how to protect an email in transit. So I want to make the point that no email out of the box is encrypted. Gmail, any form of email using Microsoft Outlook, Office 365, no matter what email service you use, traffic is not encrypted unless you specifically provide for it. So there are some services that allow you to pay a fee to encrypt Gmail traffic, and the same thing is true with Microsoft traffic. The tool that we use is embedded in Office 365, and it's called Assure Information Protection. So if you have an Exchange Online license, $4 a month per email, then you can add $2 a month for Assure Information Protection. I'm going to do a short demonstration. So I'm going to go to my live email address, and I'm going to send an email to someone else, it doesn't matter who, and I'm going to simply send this test encrypted email. And since I'm paying $2 a month for this Azure Information Protection, I can select Options, Permission, Encrypt. I could choose some other options, but by encrypting this and pushing the Send button, then the recipient, when they receive this email, instead of getting an email directly from me, gets a message that says, you have an email from Ray, and click here to either log into your previous account, your Office 365, your Gmail, or use a one-time passcode. It's a straightforward thing. What happens is that message is never sent in the clear. When you use a feature like this, encrypting an email, the click when I said protect this caused a VPN tunnel to be created to a secure website. My message and its content was sent to that website. The website forwarded not the content, but an email to the recipient saying, and that tunnel is encrypted as well automatically, saying you have a message, and when they open that message, it opens a secure VPN so that they can see the information, and if they reply to it, that reply, this is true of Office 365, that reply is also encrypted. So this is really helpful when you have a very occasional user like a patient where you want to send information that includes PHI. You can do so securely by using whatever the method of encryption is you need to encrypt. So a couple of things that are true. Faxes are okay. Faxes are analog information. They're not interpretable. It's an image. So you can send a fax, but you can't send an email unless the email is encrypted, which is what I just did, or unless we encrypt the content, which I'm going to show you how to do that in a second. That has to do with encrypting a document at rest and then sending that encrypted document. So the recipient of the email that I just sent receives a message that says, use a one-time passcode or log in to your selected provider, and then you're free and clear. So you know, I happen to send that to my colleague, Karen, who's in PBSI. When she received that, she didn't need to open anything, because when you're sending to someone inside your same domain, so at mypracticename.com, that is never exposed to the internet. I didn't really need to even encrypt the document within my local domain. You can send internal emails without concern, because those don't ever get to the public internet. And in the same way, for using this feature, Karen, in my case, received no prompt to open. But if I'd sent it to my personal email or to one of you listening, you would have received a message to open. Okay, straightforward. The important thing isn't whether you use this $2 a month option. It's that all staff knows we may not send email unless it's encrypted that includes PHI. And if we do, then make sure we have a provision in place to encrypt the email. And the goal of these webinars is education. We're not trying to sell products or services, but we know Microsoft Office and Exchange Online and this encryption and some other features really, really well. We can help any of you at base Microsoft cost to adopt any of these features. So I'm going to move on, and I'm going to demonstrate encrypting of a file at rest. So now I'm going to go to a document that each of you will receive a copy of who are attending this webinar. Will send to you a link or attachment. I'm not sure which way we'll do it. So you will actually get this document that I'm going to use. This document we've created to help clients is basically describes how you encrypt the document. You can encrypt in any Office document. So if it's a Word file or an Excel file, and I'm going to go through an example of that. And it also shows you within this document how to encrypt a PDF file. You do not, to create an encrypted PDF, you do not need a chargeable copy. You can create an encrypted PDF within the free Adobe Reader. So it's important to understand it's not difficult, and there is no cost to be able to encrypt a file. So if I wanted to encrypt a file, I would follow these instructions. And what I'm going to do now is demonstrate this. You'll see the instructions. I'm going to go to Microsoft Word. I'm going to create a new document. Here's my test document, and now I want to save this. So I'm going to save this document, and I'm going to call it, I don't save anything on my C drive. We have a procedure at PBSI where no customer documents on C drives. But I'm going to save this document called test. And so now I want to encrypt that document. I could have done it all in one step, but here are the steps. I want to encrypt the document. I say File, Save As. There's more than one way, but basically more options, tools, general options, and I give it a password to open. And if I cared about the security of this document a lot, I'd give it a longer and longer password. So I don't give it a password to modify separately, just a password to open. And then it prompts me to repeat that password. And when I do, and that document is saved, it is now encrypted. So if somebody else goes to open that document, which I'm going to do now, and they see that test document, when it comes up, it says, what is the password to open? And so forth. So it's really quite straightforward to do. In the same way, you can encrypt a PDF, but the description is a little more difficult. You might not figure this out without knowing, because the key is you choose not file save as, but file export, and you export it to a certain kind of document. So I'll do this. I'm using a PDF right now. I export to, and here's my choice to create a XML. I guess the name of this has changed. I need to update my documentation. So now that I've decided to create this kind of a document, then I would follow the settings. I'm going to go back to my instructions. Yeah, pardon me, I should have reviewed these instructions before doing this. So I'm going to click the button to create, and then in the options button, I'll get an option to do this with a password. So I'm going to do this one time, see if I can do this without being confusing. I'm going to do file export to, I will update this. Before we send this to you, you will get an updated copy that gives you exactly the description, and I'm not seeing it here. So without wasting anyone's time, I won't complete the encryption of this document, but trust me, it's free and you'll have the correct instructions. So that is the understanding I wanted to get across, is that any file you want to encrypt, any Word or Excel or PDF document, you can encrypt it, and then you could attach that document to a clear email and you would be fine. So I'm going to move on. We've talked about the fact that you must encrypt documents as they're transmitted, and it's a strong recommendation that you encrypt files at rest. And by the way, files at rest are more important to encrypt when they're more at risk, which generally means they're more portable. So anything that's on a laptop, anything that's on a thumb drive, anything that where there's any public access, then those become critical. In fact, this may not be known, but there's a fail-safe we recommend for all clients in healthcare that hard drives on laptops and tablets, anything that's portable, be encrypted. And the reason is, if you use an encryption tool, and there are some free encryption tools, one comes with Windows 10 for free. If you encrypt your hard drive, then it is a certain exclusion from the risk of needing to report a breach. So if that laptop is stolen, or that thumb drive is stolen, if the information is encrypted, you are assured you do not need to report a breach. Otherwise, a stolen laptop can be a very dangerous situation. Okay, moving on. Cloud storage. So when might I decide? Many of us, we use the cloud every day, and many of us, we think, well, I don't know if it's secure, so I want to make some things clear about this. Why might I want to consider cloud storage? There's some really good reasons. So we have multiple locations, and we want access from different locations, or we want access to some information from home and other locations. I use the cloud a lot for my personal documents. I make sure I use it securely, but when I'm on my iPhone or my iPad or my home PC or my laptop or my work PC, I get to the same documents. They're updated. They're always available. So multi-location access, multi-device access, critical need for availability. If even the few number of times my network or my internet is down at work, I can still get to the document in some other way. So critical need for availability. If I'm concerned whether my backup provision is complete, usually servers, I would expect that everybody listening, you know that your servers are protected and backed up, but PCs, not so much, possibly. And if you have concerns about hardware reliability, your files are stored in a location where you really aren't certain for sure that you would be able to recover files there. These are all reasons you might consider using the cloud. So if we're going to use the cloud, which vendor? Well, the primary vendors for most of us are either Microsoft using OneDrive or SharePoint, variation of the same thing, or Google Drive. These are secure environments, and you should know about most of these vendors, but it's definitely true of Microsoft and Google, that documents are encrypted in transit and they are encrypted at rest. So whether you want to store information with PHI on Google Drive or on OneDrive is up to you. The vendors say that these files are encrypted, but unless you separately encrypt it with a password, that's a risk that you may or may not choose to take. But theoretically, the storage devices, not the files, but the devices themselves are encrypted if you're using those vendors. So many use Dropbox or Box or iCloud or Amazon or Adobe. There are lots of others who have alternatives. The key is just to make sure that if you're going to use vendor, if you're going to put PHI there, that you know that the documents are encrypted in transit and at rest. So it's fine to use cloud storage. We support it. We use it. Just be aware of what risks you're taking on. So do I need to encrypt cloud files with PHI or PII? We recommend it. Just in the same way that I'd recommend you store a file that has PII on your C drive or on your network drive. You're preventing unnecessary risk for access. There may be other employees who have access to something that that we might violate the minimum necessary rule of HIPAA. So it's not strictly a requirement that files be encrypted if you're storing them in the cloud, simply a recommendation. So, and if you're going to store documents in the cloud, the more secure the information is, the longer you want the password to be. Okay, we've talked about we've talked about file encryption, we've talked about cloud security, and now I'm going to move on to one last topic that is related in terms of it's involved in keeping information and particularly passwords secure. So it's important to know public Wi-Fi is not secure. Well-known Wi-Fi names like Marriott or Delta or Hyatt or the like, that does not equate to secure. Public Wi-Fi is never secure. Hotels, Starbucks, airlines, restaurants, guest Wi-Fi, you might think, well, I trust Starbucks. Well, sorry, they're very trustworthy, I'm sure, but their Wi-Fi is not secure. Even though it requires a password, that doesn't make it secure. It's still public Wi-Fi because the other guest next to you can log in with the same password and they're on the same network. And password hacks are very common. I've seen a very short 5-minute demonstration. We use a security vendor called KnowBe4. We offer security training from, and it's a very compelling demonstration of how somebody with a backpack sitting in their car next to a Starbucks can easily, with free tools, be recording, and their battery-powered laptop. They're recording every keystroke of every user in that Starbucks. So if you go to your bank site and you key in your password, guess what you just did? You exposed both your login and your password, and that's really, for most of us, it's just unacceptable and it's unnecessary. So just beware, public Wi-Fi is not safe. And there is no such thing as Google Starbucks or Trump Wi-Fi was used to scam reportedly 1,000 Republican National Committee attendees back when, where people said, oh, Trump Wi-Fi, well, that must be secure. Well, it was a complete scam. A hacker was gathering email logins and passwords from all of those high-powered individuals. So what is a VPN? How do you make sure you can use Wi-Fi securely? And the answer is you can use a VPN, which is a virtual private network, which establishes a point-to-point encrypted private channel between you and one other resource. So you're always at one end of a VPN, and either your bank or, in the case of Microsoft's Azure Information Protection, the site is a private place in Microsoft's cloud. Wherever you're connecting to, between you and your office, a VPN establishes a tunnel where everything inside of that tunnel is garbled and cannot be interpreted by anybody watching the internet. So VPN software is simple, it's inexpensive, there are some free options, and it simply redirects your internet connection through a secure place that ensures the traffic is garbled. So very simple. So if you want to use a VPN, I use NordVPN. It's $29 a year, something like that. There are some free VPNs. I generally stay away from free security products. Why is that true? Every vendor of a free security product also offers a chargeable version. Think about it. Why would they charge for one? What is the difference? The answer is, if there is a difference, I'm not going to wonder about it. But the fact is, most free products, they're not free. Why are they free? Because they're getting revenue someplace. Where are they getting revenue? Well, the answer almost universally is by the way they use the information that we provide to them. So we become their revenue source with other marketing. And generally, they're not selling information. I'm not worried about Amazon selling to bad guys my information, but the fact is a vendor of free, even VPN software is getting some marketing revenue by the use of my information. So VPN software is simple to connect. We have a link here to the best VPNs. This is from PC Magazine. There are all kinds of sources. If you Google best VPN, don't choose a vendor site to tout their own products, but there are a lot of these products that are well regarded, and some of them are free. You can also click best free VPNs. So the idea is once you set up a VPN, I don't use it on my PC because I don't need a VPN. My PC, I don't send anything from my PC at my desk that is insecure. But if I am on my phone, I have this VPN installed on my phone, and I simply turn it on and connect the spot, and then I can use public Wi-Fi securely. Once your VPN is in place, you are safe with any traffic that goes from your PC. So if I'm on my iPhone or my iPad, I'm in an airport or my laptop, I connect to a VPN before I log into my bank or another site. Okay, so VPN software is one way that you can always be safe on public Wi-Fi. Another important note, cellular is always safe. If you simply don't connect to Wi-Fi, use your cellular. Cellular is encrypted, encoded, you're safe. You have no fear if you're using cellular on your phone to connect to your bank. No problem, can't be interpreted. Also, things like Google searches or things that aren't secure, that's what public Wi-Fi is for. You want to read a book, and I do this all the time on your electronic device without a VPN, no problem, nothing to protect. So either use cellular or don't do something that's requiring a password, or use an app. So most bank apps, we presume, we don't really vetted the bank apps, but if you're using your Huntington or your US Bank, your Fifth Third, or whatever bank app, presumption is they're creating a VPN before they're logging you in. So it's simple to be safe, you just need to do it. So I have a picture here that simply shows when I'm on my iPhone, if I click VPN, then this is actually a screenshot of my iPhone where I had connected to a VPN, and next to my wireless signal, it shows this. So once I connect to my VPN, I can look on the top of my iPhone always and know that I'm secure. If that is not there, then I'm not secure. So this is simply a way that you are, when you're public and you think you've used a VPN before you log into your bank site, can you see for sure, yes, you're protected. Okay, we're finished with content. We're almost at our 1.5 hour mark. I'm just going to summarize quickly. Security principles for documents: encrypt files at rest, encrypt files in transit if they contain protected information. Consider, if you want to use email for secure information, adding a product to your email suite that allows encryption. We're happy to provide information to anybody who has questions. How do I do this with Gmail, or how do I do it with Microsoft Office? And what needs local encryption at rest? Upcoming webinar, we're going to demonstrate a product that allows us to electronically find all documents that are at risk. This will be in the webinar on June 25th, how to find unprotected EPHI. We'll do a demonstration where you can know how much data you have that is at risk. So anyway, if you're unsure, what do I have that needs encryption, there's an easy way to find out. When you're using cloud, use it securely. When you're using public Wi-Fi, be safe. So I want to thank you for your attendance, and I once again want to thank our partners at the Academy of Medicine for envisioning the need for this information. If you have questions or you'd like to explore, we offer discounted services at various discount levels for all Academy members. So ask us if you wish for a quote. And we're finished with content. Thank you very much for your attendance. I hope everybody has a good day.